Hello, my name is Willa Potosnak. This summer, I participated in Carnegie Mellon University's Robotics Institute Summer Scholars Program, where I worked in the Auton Lab under the mentorship of Dr. Archer Dabrowski and Dr. Kyle Miller. Our research project is titled ROCCER Evaluation within Federated Classifier Selection for Improved Identification of Center Collaboration Opportunities. Our research stems from the concept that data is inherently heterogeneous between hospital centers due to varying patient population characteristics and hospital practices. As patient population characteristics and practices vary between hospitals, centers may specialize to certain populations or subpopulations, and so possess expertise that can be shared to benefit other centers. An explicit and translatable understanding of center expertise is important to promote collaboration among centers for best practice adaptation and risk model development. Machine learning models, particularly decision lists, can be used to help gain this understanding. Previous work leverages decision lists to provide insight into beneficial center collaborations. The Federated Classifier Selection algorithm, or FRCLS, generates a decision list that dynamically guides classifier selection for patients. The decision list rules, which are derived from patient data, can be used to understand when the external classification model is more competent for patients from the local center, and if collaboration among centers is potentially beneficial. This research evaluates the application of ROCCER within FRCLS to assess if rule selection using receiver operating characteristic, or ROC analysis, generates decision lists with improved insight into potentially beneficial collaborations among hospital centers. We evaluate two rule selection methods used to generate the decision list within FRCLS. One method is ROC analysis using ROCCER, and the other is the current method with a rule selection heuristic based on maximizing the lower bound on the mean. The decision list generated using each rule selection method within FRCLS is evaluated to determine which rule selection algorithm shows more significant results regarding the number of patients with predictions flip from incorrect to correct using the external classifier. Significant results would indicate the utility of the decision list rules to discern patients who would benefit from the use of the external model rather than the local model. The FRCLS test set results for the ROCCER generated decision list show false positive rate regions with smaller p-values compared to using a rule selection heuristic that maximizes the lower bound on the mean. This result is seen in regions of smaller false positive rate values, which have particular importance for clinical model development. This research shows that rule selection using ROC analysis has demonstrated improved rule utility over the current rule selection method for several regions of false positive rate values. Significant results at more model false positive rate values, particularly within 10%, would be needed to help confirm this conclusion and the application of ROCCER within FRCLS. Future work will include incorporating significance testing in ROCCER. We will also research the application of FRCLS with artificial data silos based on time period for the purpose of discerning beneficial and harmful practice updates over time. This material is based on work supported by the National Science Foundation under grant number 1659774. Thank you to the RISC program sponsors and Carnegie Mellon Robotics Institute for supporting this research. I'd like to thank Ms. Rachel Burstein and Dr. John Dolan for their work in making the RISC program possible. I'd also like to give a special thank you to Dr. Archer Dabrowski and Dr. Kyle Miller for their mentorship and guidance throughout this research.